Hi, welcome to another episode of the Rotator Cuff Experts. I'm Dr. Orcutt. Today we're going to talk about a couple things. One of the comments actually on the YouTube channel asked me to discuss margin convergence. And that's a technique of how we fix the rotator cuff. There's another technique called interval slide. So we're going to go over both of those today. Hopefully it gives us an idea of what this is, and so it's not so foreign to you. Right. So first on, we're going to talk about interval slide. So if we look at your rotator cuff, if we're looking at kind of head on, so if you're looking at my shoulder like this, right, in that way, it's going to be right here. So there's the ball of the ball and socket joint. The socket's underneath there. You can't really see the socket. And then you have three rotator cuff. There's technically four. There's another one back here, but we don't care about this so much. This is the front of the shoulder. This is the top of the shoulder, and this is the back of the shoulder. So we look at the rotator cuff. We know in the front we have the subscapularis. In the top we have the supraspinatus. In the back we have the infraspinatus, and then we have the teres minor. But again, teres minor doesn't get much love because it's rarely ever injured. So when you talk about if we have a big tear and we have some of this, some of the tendons have been retracted or pulled away from the bone. Sometimes it gets really scarred in between the supraspinatus and the infraspinatus, or between the supraspinatus and the subscapularis. And it's hard, and as you know from the other channel discussions we've had, we know that the supraspinatus is the dominant rotator cuff that's torn. Now, oftentimes we can have other ones, but usually it's the supraspinatus, and it may enter into the infraspinatus, or the supraspinatus entering to the subscapularis, or all three of them. But the reason why the supraspinatus gets torn more common than others is because it is the dominant force in letting us elevate the arm. And so that's why the supraspinatus is the most commonly torn, and the most commonly significantly torn, right? We may have a smaller tear in the infra or the subscapularis, but the supraspinatus is the tendon that is most likely, if there's going to be a severe tear of the rotator cuff, most of the time it will be the supraspinatus. So there's obviously exceptions to any rule. So it gets retracted, pulled back from where it's supposed to be attached, and then it gets healed in, scarred in to the more normal subscapularis or the more normal infraspinatus. A technique to get the supraspinatus mobile again, to try to get it back to where it's supposed to be, is what's called the interval slide. When we look at these kind of blend together, right? There's not really an obvious defect between them, although you can find it if you look. So what we do in the interval slide, and we may release, so cut the tissue in between the supraspinatus and subscapularis, or we may cut the tissue between the supraspinatus and infraspinatus. When we cut that, it gives us more mobility on the supraspinatus and hopefully be able to get it back to where it's supposed to be. Again, that's called an interval slide. In the two intervals we use most often is the interval between the supra and subscapularis, and the interval between the supra and the infra. So that's the interval slide. So hopefully, if we're lucky, we do these releases and all of a sudden the supraspinatus comes over, and then we can put a couple anchors down here, put some sutures here, and get it tied back where it's supposed to be. As we've gotten better in releasing the rotator cuff, and as we have all the other alternatives like superior capsular reconstruction, or the balloon arthroplasty, or the reverse, this plays less of a role, but it's still an important role. So that's the interval slide. The second thing we're going to talk about is margin convergence. So margin convergence has to do with when you have a tear, and most of the time, again, it is the supraspinatus. This is this one, the supraspinatus. And what happens is you have a unique U tear there. So what happens is the front of the supra and the back of the supra are okay, but the middle of it gets torn and pulled back. When you try to get this and pull it back, it won't go. It won't come all the way back where it's supposed to be. So some smart guy said, okay, what if we do this? Instead of trying to get it all the way back, we converge the margins. So we instead bring this back together where we tie these two. We converge the margins up here, and then we end up with these two a little bit shortened, and then typically we'll put an anchor right here. So now we have a more normal-ish, not normal, but normal-ish rotator cuff that looks like this because we tied it together. Same thing, then we can take a couple sutures, tie that back down where it's supposed to be. And that is margin convergence. Again, mostly used in the supraspinatus. If we have a bad subscap tear where it's pulled back and it's kind of crappy tissue here, or we lost some tissue, then that's what we use for margin convergence. So I hope this helps. Margin convergence interval slides, 2 techniques to help repair the rotator cuff. Again, we use them maybe not quite as often as we used to. I think partially because we get to rotator cuff tears faster, so we're able to fix them before they're really, really big. Or if they're really, really big, oftentimes, because we know there's a high chance of re-tear, that we may just go to something different. Again, like a supracapsular reconstruction, or reverse total shoulder, or balloon arthroplasty. Again, I hope this helps. Please leave any comments, questions for us. Please like the channel. Please subscribe to the channel, and we'll see you next time. Thanks.